And if a patient comes into me and they say, "Oh, this movement is painful," then so let's say elevation's the problem. I think there's a lot of contention about why symptom modification works, but in my head, I want to make life easier for the shoulder, so I can immediately make it easier by unloading it. So I would just get them to bend their elbow and try and repeat the movement, but I generally get them to make a fist, because we know if you make a fist, it just upregulates the cuff. It just gets everything ready for action because your brain thinks you're going to move your shoulder. Now, it could just be I'm getting them to start the movement in a different way, and it could just be unloading. So there's lots of things that potentially allow it to have a positive effect. So I've unloaded it. If that doesn't make a difference, the next thing I'll do is add some resistance at the back of the wrist. Now, we have evidence showing that that just upregulates the posterior cuff. In elevation, the posterior cuff should be working harder. So that's my rationale. But again, the fact I'm giving them a resistance to work against, it's reinforcing selective movement. And again, maybe just getting them to start the movement differently. But if I do that and it makes the pain better, I can just give them an exercise that replicates that by giving them a loop of TheraBand that does the same thing. If that doesn't change it, then I'd go on to a scapular assistance test. And we still have a lot of experts out there that say if you do a scapular assistance test and it makes their pain better, you should do scapular-based exercises. I don't necessarily agree with that. I think when you put your hands on the scapula and make it move better, you're giving tactile input, you're unloading the shoulder. Again, all it means to me is I'm going to put a bit of TheraBand around the back, or I'm going to get them to lean against the wall with a loop around their wrist, so that whatever changed their pain in the clinic becomes the exercise, their first foundation exercise. And again, they'll do that through range. If none of those things work, then the final thing I'd do is add in the kinetic chain.